Good morning, Ms. Zakar. My name is Clairine Crestella from Class A 2024. In this opportunity, I'm going to do my research presentation with the title of the research article is Design and Evaluation of the Floating Oral In Situ Gelling System of Levofloxacin Hemihydrate to Dysphagia Patient. For the research background, levofloxacin is a broad-spectrum antibiotic that is part of the second-line therapy regimen that's supposed to be combined with omeprazole and amoxicillin in the treatment of PUD. This second-line therapy is used when the first-line therapies such as lansoprazole, amoxicillin, and clarithromycin failed due to H. pylori bacteria. When using antibiotics, compliance is necessary because it can lead to antibiotic resistance, which worsens PUD due to the immunity of H. pylori. If resistance occurs, it is necessary to maintain antibiotic contact with the stomach for longer so that the bacteria can be eradicated completely and does not cause further resistance. Unfortunately, in Indonesia, levofloxacin is only available in tablet and injection form. This reduces treatment compliance in pediatric and geriatric patients, as well as patients who have difficulty swallowing. This problem increases resistance possibility. That is why in this research, the writer utilizes a floating system with oral liquid in situ gels. This system optimizes the efficiency of levofloxacin in treating bacteria in the digestive tract by ensuring longer exposure to H. pylori bacteria. Next, for the research objectives, the first objective is to develop an oral liquid preparation of a floating in situ gel system for levofloxacin hemihydrate. Because to the best of our knowledge, no oral liquid formulation have ever combining floating and in situ gel system for levofloxacin hemihydrate. Not just that, this research was also conducted to determine the optimal formulation of the system and explore the potential of oral floating in situ gel preparations of levofloxacin as an alternative product for geriatric, pediatric, and dysphagic patients undergoing infection treatments with sustained release delivery system. System and the mechanism. The system can be formulated with HPMC and sodium alginate. Sodium alginate is widely recognized as leading RAF forming agent, while HPMC has been successfully utilized in sustained release formulation. The mechanism of action of the system is that the liquid medication can then turn into a gel due to contact with the absorption area, which is influenced by the temperature, pH, and acidity levels in the stomach. The preparation can float in the stomach because its density is lower than gastric fluid, which is achieved through gas formation and the use of polymers such as sodium alginate that can retain the gas. These are all the materials that were used in this research, and these are the procedures. So the first one is preparation of levofloxacin hemihydrate floating oral in situ gel. The following tables show the different formulation tested by the owner. Next, after the preparation, there is evaluation of physical appearance and pH, in vitro floating studies, in vitro gelation studies, measurement of viscosity, in vitro drug release study, formula optimization, and modeling of drug release kinetics of optimum formula. Moving on to the results and discussion. The first one is physical appearance and pH measurement. So all formulation produce a yellowish color and viscous liquid appearance, and every formulation's pH is in the range of 7.78 until 7.83, indicating that the formulations were stable in their liquid phase. And the variation in concentration between the two polymers does not significantly affect the pH. The second one is in vitro floating study. All formulation dissolve immediately upon the contact with the medium, which is chloride acid, to mimic the acidic conditions in the stomach, with a lag time ranging from 17 to 80 seconds. Floating performances of all the formulations exceeding 24 hours. And the variation in concentration between the two polymers that not significantly affecting the floating performance. For the in vitro gelation study, the developed formulations demonstrated the ability to form gels instantly and maintain their structure for extended periods. Next, viscosity. The viscosity of the formulations ranged from 20.25 to 39.88 centipoise. All the prepared floating oral in situ gels exhibited edu- adequate porability, meeting the criteria for patient-friendly medication administration. And for the in vitro drug release, the analysis indicated that variations in polymer concentration did not significantly influence the in vitro drug release, which ranged from 80.69% to 96.51%. For the formulation optimization, the optimization process procured an optimal formulation with a high desirability value, which is 0.907, consisting of 0.122% HPMC and 0.378% sodium alginate. The physical properties of the experimental formulation did not differ significantly from the prediction. And for drug release kinetics of optimum formula, the drug release kinetics study showed that the optimal formulation released revofloxacin gradually and in a controlled manner. The release data best fit the Higuchi and Korsmeyer-Peppas model, indicating that the drug release mechanism is controlled by diffusion through the gel matrix and polymer relaxation. This release profile supports the use of the floating in situ gel system to maintain antibiotic concentrations in the gastric mucosa for a longer period of time. The conclusion of this research is floating in situ gel levofloxacin effectively prolongs gastric residence time by forming a floating gel after oral administration. The optimal formulation provides controlled and sustained drug release, which sustainable for Helicobacter pylori therapy. This system has the potential to improve eradication efficacy and reduce antibiotic resistance. The strength of this research article is demonstrates effective gastroretentive behavior, shows a consistent controlled drug release profile, and results indicate strong potential for improving local drugs exposure. Meanwhile, the weakness is limited to in vitro studies, no in vivo or clinical evaluation, and antibacterial efficacy against H. pylori not directly assessed. And the last one is long-term stability and performance under varying gastric conditions not fully discussed. That's all from me. Thank you for listening to my presentation.